Welcome back to Mothers in the Middle. Today's guest is Dr. Ify. She is a mom, a professor, a radiologist, and a fierce advocate for women's breast health. I have personally learned so much from her. She has this knack of turning very complex information and converting it into something that is digestible and accessible for all. Laura and I were so honored when she agreed to join us on our podcast. We look forward to you having a listen. Let's get into it.
All right. We are rolling. Okay. Welcome to Mothers in the Middle. Hi, Dr. Ify.
Hello, Laura.
Hi, Leslie.
Hey, girl.
How's it going?
Hi, Leslie.
We're doing it. Hey, girl. We're doing it. Okay, so before we get started, I think it's nice for us to do some icebreaker questions. So, Dr. Ify, tell us, what is one thing right now that's bringing you joy lately? And it could be something big or something small.
Oh, something that's bringing me joy. Oh, my goodness. Honestly, my social media projects and teachings, that's bringing me joy.
Okay, so okay, and we'll get into that
Yeah.
a little bit more. Okay.
And my question is, if you had a theme song
Ooh.
to where you're at in motherhood in this season, what would it be? And feel free if it's not a song and more a theme of where you're at in motherhood. It can be,
Related to motherhood?
yes.
Ooh. A theme song.
Mm-hmm.
It's very hard.
Just think of one of those songs you listen to when you're like going hard in spin.
It's not motherhood related. because
Okay.
The song that popped into my head is totally not motherhood. You know, it's like, it's Christina Aguilera's Just Dirty.
No. Okay.
Okay.
So that.
But listen, I think it's important in motherhood because just because you're mother doesn't mean you got to be like, you know,
Mhm.
straight-laced,
I agree.
You know? Yeah. Yeah, I'm going to go with that.
Okay. Okay. And if you had to describe yourself in 3 words, what would they be? And which one would your mom agree with the most?
Okay. Highly empathetic. That's one word. Okay. High. Confident. You guys are putting me on the spot.
Yes, we are.
Passionate.
Okay.
Yeah. I think my mom would agree that I'm a high impact.
I'm advocate. I agree with that too. Just in like the little time that we got to speak before we started, I agree.
Thank you.
Yeah, as your friend, you totally agree. Yes, very much so.
There's so many words, but I'm like, okay, I have to choose 3. And I'm like,
You can say, listen,
narrow it down.
let's normalize speaking highly about ourselves.
Yeah.
Like, we need to normalize that.
Yes.
So,
Yeah.
do you have more? Because if you have more, I'm all for it.
No, we go through
Okay.
We'll get into it.
All right. So, I'm going to do an intro.
Okay.
Today's guest is a true girl's girl. The kind who shows up with wisdom, heart, and the receipts to back it up. Dr. Ify is a professor at the University of Alberta, a radiologist, a mom, and finish the sentence. She is a furious advocate for breast health education, and she has a gift for making complex medical information feel accessible, especially for women who've historically been left out of these conversations. She brings care, clarity, and a deep sense of purpose to everything that she does. We are so excited to have you here on Mothers in the Middle.
Thank you so much. And I'm so happy to be here.
Oh.
My first official podcast guest.
Oh my goodness.
Wow. I love this. This is awesome. Thank you for
Price
having
going
me.
up.
Pleasure.
That's awesome.
So I'm going to lead into this question with you.
Okay.
You're a radiologist, as I said, a mom, a passionate health advocate, literally how we met.
Mm-hmm.
What sparked your interest in radiology And for those who have never heard the word radiologist, what does a radiologist do?
Okay, let me start with what a radiologist does. Okay, because a lot of people really don't know what radiology does, right? With radiology, we use imaging to look into the body, right? We are diagnosticians, but we also treat. It can be interventional. And that's why, like, we go to school, we do our pre-med, which is usually 2 or 3 years, some people 4. Then you do med school, which is usually 4 years, some people 3. Then you do your residency. Radiology residency is 5 years, right?
Okay.
A lot of people think, so after high school, and then after a radiology residency, sometimes you could do a fellowship, right? So by the time it's all said and done, a lot of people have done like maybe 11 to 12 to 13 years post high school, right? And we work with radiation technologists, and they go to school for about 2 years, some 3, some 4, right? And we work collaboratively with them. I can't do my job without them. They can't do the job without me. And that's what we do. A lot of people don't realize that we are physicians, and we are very key to the diagnosing, issues in patients and stuff like that. When people think of doctors as your surgeon, right? Well, surgeons, their residency is 5 years.
Yeah.
We're 5 years too.
Yeah.
Right? And if they go to the OR, they need us. If you have cancer, they need us. Like, we are very key to the medical, as other medical specialties are, but that's who we are.
Okay.
Yeah.
And what drew you to this line of work?
Oh my goodness. Okay, so this is the thing. Like, radiologists, a lot of people think of us because we work in the dark quite a bit, right? You were sitting there reading
vampires.
Yeah, vampires. When people think of radiologists, they think someone sitting in a dark room reading X-rays and stuff like that. But there's another component to us. So, for example, I do a lot of breast imaging, and I'm dealing with people quite a bit, right? And so, what drew me there, to be honest, when I was thinking of what was I going to do, when I thought, okay, I'm going to be an obstetrician because my dad was one, and it's baby's happiness. I mean, right? And he's like, no, don't want to do that, lifestyle, whatever. So I was like, okay, not that. So then I decided, you know what, I'm going to do ENT just because I thought the professor that taught us was cool. So I'm going to do that. And so then I went and did my elective. And as I was rounding on patients at 4 a.m, I'm realizing, like, this is not going to be my life. Right? But what's the option, right?
ENT,
like ear, nose, and throat. Like, we're doing facial dissections, 13-hour surgeries, right? And I'm standing there, holding retractors and almost falling asleep. But then what happened was, we would see the patients, and then we'd see the imaging of the patients. Or actually, it was the opposite. We'd see the imaging, then we'd go see the patients. And I was like, wow. I love this. Like, it's black and white and shades of gray in a not dirty way, but and it was everything. Like, you could see everything about a patient in there, right? And just a little difference in a shade of gray could tell you everything. And I just fell in love, like, wow. And that's how I got into it. So I realized, okay, this was at the very last moment before we could apply for matching.
Okay.
And I brushed up, did some one elective with my holiday, and that's all I applied for, because I'm like, this is it. There's nothing else for me.
And for someone who does not know the medical world, what does matching mean? Like,
so when we do med school, at some point we have to decide, what do you want to do? Right? And
which area?
Which area of practice do you want to be in, right? Do you want to do family medicine, or do you want to do ENT or radiology or ophthalmology? And then we have to apply.
Okay.
So we go through a CARMS process, CARMS match. So you can apply for different things all over Canada, and then you get matched to a field, right? So if I, for example, apply to radiology and maybe ophthalmology and family medicine as backup, there's a possibility that, after when you go and do the different interviews, maybe I pick radiology in Calgary as my number 1, but they don't pick me.
Okay.
But I may end up in ophthalmology, which is a great field, but that's not my passion, right?
Okay.
Right. So to eliminate that, I just apply for radiology because a lot of people will apply for something and then they'll apply for a family medicine as a backup just in case.
Okay.
I was like, you know what? No. If I don't get radiology, I'm gonna wait.
Wow.
Because I knew that was my call.
Okay.
Yeah.
Oh,
I love stories, Allison.
Yes.
nice.
So that's how I ended up there.
Okay, so fast forward to you've been a doctor for how many years now?
Oh my goodness. Well, so technically when you finish med school, you get your MD.
Okay.
And I got my MD in 1988.
Okay.
Just want to make sure that's correct. But then it's kind of like you have this MD, but you can do nothing with it,
Yeah.
right? Because you can't practice until you've done a residency,
Yes.
right? So I finished my residency in 2003.
Okay.
And I did it in MIGA.
Okay.
Yes, I know.
I'm
I was Francais, yeah. Oh, yeah. And so that's when I finished my residency, and then I came to Edmonton to do
Radiology. Okay, so 20 years, more or less, a little more over 20 years.
Yeah.
Over 20 years. And, you'd mentioned a little bit about how you're often doing imaging for women with their breast. So you talk a lot about on your platforms about like breast awareness, all that stuff. So one, I know when it comes to, and I really want to like highlight this, and I want to say it right. When it comes to Black women, right, the rates of breast cancer are much lower. But when we do have breast cancer, the rates of mortality are much higher. So can you explain a little bit like why that is, or if there is like a scientific explanation?
Yeah, I wanna start off with, like, I feel like, so even though I did the radiology, falling into the breast imaging aspect, I don't know, I feel like this is where I should be, really, because the way I just kind of landed, the first place I called, to opening up a women's imaging center, and they needed a woman to do breast imaging, right?
Okay.
And that, in fact, that's one thing I knew that I would not do.
Okay.
Oh.
Because when I went through residency, the plan was we were not going to have kids till we were married for 5 years, and certainly not during residency, okay? Especially the final year, because it's chaotic, right? And we got a wonderful surprise in our final year. And when I was pregnant, my first trimester, I was so tired. And the residency block that I was in was mammography. And my first trimester, I was so tired. And mammography, breast imaging, attracts, women.
Yeah.
Very maternal. And I would go sleep. So I slept. I slept through my mammography, which was okay because I knew I would never do it, right?
Yeah.
And then when it was time to find a job, it's like, this is what they did. I'm like, shoot, now I gotta do this. I slept through it, right? So then I had to like start all over again and, learn it and stuff like that. So anyway, so then I ended up there. And so now I look back on it, I'm like, wow, this is where I'm supposed to be. Because like you mentioned, we as Black women, our incidence of breast cancer is lower, but our mortality is 42% higher than white women, right? Like, that's a significant number, right? Why? It's not just one reason, there's definitely probably a genetic biology component, which is being studied. And as I'm saying this, I want people to know there's a lot of clinical trials going on, and we need help in that. So for Black women to agree to participate in those trials, because if we're not agreeing to participate in those trials, then how are people going to, what's the own data, right?
Yeah.
Exactly. We tend to have more aggressive cancers. So if someone says to you, the different kinds of cancers, breast cancer, you want to have a hormonally driven cancer because then you have something to treat it, to target a treatment, right? Black women have, we're more likely to have a triple negative cancer, meaning it's not hormonally positive. And so the treatment is difficult. It's more aggressive, right? And it tends to spread more. We tend to present later and with larger tumors. I think part of it too is just that stigma of having cancer, the C word, to say it. I'm Nigerian, so, a lot of people don't want to, don't say it. that means like, don't even say it,
Like,
don't say that word, don't breathe it into existence, because if you breathe it, if you say that word, then maybe, well, guess what? Like, if you try to hide it or not talk about it, cancer doesn't care. It's there, it's going to happen, and it's going to keep on growing, right? And so there's that stigma, and then maybe you have it, that you are considered as a lesser being, no one's going to marry you, and which is sad, because there's so much now that can be done with breast cancer treatment, reconstructions, and if it is caught early, right? And so there are a lot of reasons. There's also the belief that the Black people are more prone to hypertension, diabetes, all these factors, and also socioeconomically, especially in the States, where that plays a bigger role, where this whole insurance thing, you need to have insurance to get your mammograms, right? Prevention, early detection. Well, if you're not coming to get early detected, then by the time you show up, it's later. So it's a lot of reasons,
Okay.
right?
And it sounds like a lot of reasons depending on where you are geographically.
Exactly. And even in Canada, I mean, so a lot of places you can now get a mammogram at age 40, but that didn't used to be the case. In Alberta, it's your first mammogram, technically self-referrals would be 45. But if you want 40, you have to go talk to your doctor, right? So in Canada, from province to province, it's different. Where you live in the world, it's different,
Wow.
In Africa, like, we don't have as the amenities as we have here, right? And that really saddens me, because when I see, having grown up in a third world country, with the amenities or lack thereof, and some of us have chosen to come here and live here, but then you still decide to not take advantage of that.
Yes.
Right? Like, I've been back home where there's not mammography machines, but they're broken, or you don't have power, right? Machines need power, electricity. And you come here, you have all this stuff. Like, you still don't take advantage of it. Like, we should be responsible for our bodies. This is ours, right? And
It's a gift.
it's a gift.
It's a gift that
Totally. Yeah. And I say, like, we have the power to choose. You choose. Like, I'm gonna see you at some point in the journey. You get to decide, do I see you early or do I see you late?
You're touching on my next question, essentially, which is, as mothers, and I'll use myself as an example, our health usually comes last. And many of us were raised in homes where we didn't talk about breasts.
Mm-hmm.
So what are cultural barriers that you see, and how can we change that narrative?
Mm-hmm. Yeah. Good question. Like you mentioned, we don't talk about breasts. Like, I have 2 girls. And I remember, for me personally, growing up, like, I come from a family of 7 girls in my home, 7 kids, 7 girls, and then 10 boys, like the 2 boys. And I remember my mom, she didn't talk to us about periods and stuff like that. She gave me a book to read. I opened it, I was like, yo, and I threw it out.
because everything is so taboo.
It's so taboo.
Especially
You don't
in our
talk about,
cultures, yeah.
there was no talk about breast development or anything like that, right? My girls, it's different. Like, we talk about everything. We have to normalize that part of our body. We have to normalize just talking to our daughters, to our kids, about knowing your anatomy, knowing how to do self-breast examinations. We take sex ed and people talk about the birds and the bees, but you don't talk about your breasts and knowing the possibilities. As Black women, and not just Black women, we have little benign growths like fibroadenoma, as I always tell people, think about it like fibroids in your uterus, right? But these are things you have to, like, feel to know what's normal for you.
Yeah.
So I think that's definitely part of it. And culturally, we tend to not do that as much.
Oh,
It's like, don't talk about stuff like that.
And to add, to your point, and I think this comes from me, like my sister and I, like, we are born in Canada, and I always say I got the best of both worlds, because at home it was very much Congo, but I grew up in a Western world, and I always talk to my boys, right? I have a daughter, but I have 2 boys, and I am very much, no, you are going to hear it from me, not your little friends.
Yes.
My kid, my 10-year-old didn't want to take sex ed class, and he goes, I can just Google. I said, absolutely not, because I don't know what you're going to find.
Yeah, because if you want him to have your principles, you have the responsibility to tell them, to
And
teach
teach
them.
them.
Yeah, and sadly, a lot of parents, they leave it to the schools to teach.
And I think it's also like, just going back to the thing on like the cultural piece, like I think it's, me and my husband, we always talk about this, like your parents and our parents, they essentially, they only gave us what they
knew.
You know?
They did their best.
They only gave us what they knew. And a lot of it is like, they grew up in an environment where it was built around a lot of cultural principles, ideas, and values. And it was like it's respect, So there are certain things that they can't even fathom, like talking to us about.
Oh, yeah. Even till now.
Yeah, it's like an abomination.
Yeah.
Of like, they can't do this, they can't do that. And I just want to touch on one other point, because you talked about, how you have, you said we need to normalize.
Yeah, we have to change that.
We have to normalize. So you've created this like platform where you talk about, like, I guess, should I say breast awareness? Is that like?
Yeah, breast awareness, breast health,
Breast health.
and my just being, just being, have fun, be yourself. But it's super important for me to, I love talking about boobs. You know?
So, and you also kind of made the comparison to like growing up, you didn't, like, that wasn't your norm. So one, where did you learn that? And then also too, you mentioned earlier when I think you were answering one of the questions, you talked about how, we have this advantage. So what do you want, like, I guess, Black young women to know? Because I'm 31, I'm turning 32 in September. I don't think I've ever had a mammogram. So like, is this at my age, whether like I'm like for millennials or Gen Zs, like, is this something that should be like in our brains? Like, should we be like going to our doctors and being like, hey, you know what? I'm learning about, breast health. I want to get like, should I be getting a mammogram? Like what is it? What's the guide? And especially because we said that Black women were not always mindful of this.
Yeah.
How can we change that?
So I think knowing, first of all, mammograms, early detection is key. And mammograms are one way that we can detect cancer early. Okay. Yeah. And we say the most lives are saved when you start screening at age 40.
Okay.
Okay.
Yeah.
That being said, Black women, Ashkenazi Jewish women, the risk is higher. So we say the American College of Radiology recommends that at least by age 25 to 30, do a risk assessment.
Okay.
So what is a risk assessment? It's an online platform, and there are different ones. You go on there, you plug in information. It's going to ask you your age. When did you get your first period? If you know your breast density, ask you questions about family history. So in order to answer those questions, there has to be a conversation. You have to know, right? And at the end of it, it spits out a number, a certain percentage. And it tells you your likelihood of developing breast cancer in like 10 years or 20 years, right?
Yeah.
And if it's a certain number, then you may qualify, like, so for example, it's 20 to 25%, depending on where you are.
Okay.
Now you're high risk. And if you're high risk, in Canada, you get, and in the States as well, and probably other parts of the country actually, of the world, you can get breast MRI.
Okay.
To add to getting a mammogram.
Okay.
Right?
Nice.
So these things are important to know. Or it just increases your awareness of what your risk is. Maybe you get an ultrasound. Now, I said 40. That being said, if you have a primary degree relative, so as an example, let's say my mother was diagnosed with breast cancer at age 45.
This is your mother.
No, let's say my mother or my sister. So a primary degree relative.
Okay.
Now I'm not going to be starting mammograms at age 40. I'm going to be starting 10 years before age 45.
Okay.
At 35. So you want to start mammograms routinely for average risk women.
Okay.
At age 40. But if you have a primary degree relative that has been diagnosed with breast cancer, so your sister or your brother or your mother, you want to start 10 years before age 4, before the year that they were diagnosed.
Okay. You just led with curiosity there. You said your brother. So I feel like, and you're the best person to ask this, like, men get breast cancer?
men get breast cancer. Now, it's not as common as
Okay.
women, like it's
Okay.
1%, right?
Mhm.
But men do. And some of that could be hereditary. You know, like maybe the breast cancer gene, Beyonce's dad has a breast cancer gene. He's got breast cancer.
Oh,
right.
okay.
Yeah. So most people know, we'll talk about celebrities, right?
Okay.
Yeah. So yeah, and they are a primary degree relative. In fact, if you have a man that has had breast cancer as a relative, it sort of bumps your risk up because that's unusual. And you can why did he get that?
Yeah.
So it kind of signals, is there a genetic component? There's, if you pay attention, there's a huge discussion, awareness now about doing genetic testing,
Yes.
right? And then again, that's important. So in order to know what to do, you have to have the conversation, because it will sound something like, oh, my mom had it and her sister had it and auntie had it too and the brother had it, or there's just a lot of it.
There's
And
a
it's not,
pattern.
there's a pattern, and it's not necessarily just breast cancer, right? It could be ovarian cancer, pancreatic cancer. That should kind of make you start to think, that's unusual,
I have another question, just because and this is more so I'm asking this for myself, but I'm also asking for the viewers. So if if you're in your 30s, right? And a lot of people, not everyone, but a lot of people are having their kids, and so they're going for the ultrasounds in those areas, not necessarily your breast, but you mentioned ovarian cancer. So does that count? Like, for example, like me, when I was pregnant, I had so many ultrasounds. So when they were doing the ultrasound, would they have detected something? Or can I, if I'm someone who I'm listening to this and I'm like, okay, well, you know what? I've done so many ultrasounds, so I'll just worry about this when I'm 40 and I'm a Black woman listening to it. Should I leave it at that? Or should I be like, okay, you know what? I could be at risk for this. Maybe I should do the risk assessment, like you said. And depending on the risk assessment, I'll see where my percentage is and then talk to my doctor, or do I do nothing?
So as an example, if you're going for an ultrasound when you're pregnant,
Yeah.
we're looking at the baby,
Okay.
right? We're looking at the baby. If we're lucky, we may see your ovaries depending on how pregnant you are, because things hide, right? And that's it, right?
Okay.
When you go for an ultrasound, it's for something specific.
Okay.
So we're not looking at the abdomen per se. So I'm not looking at your pancreas and your liver and spleen, unless there's a specific issue, right? We're not looking at your breasts, right? Unless there's a specific issue.
Okay.
And the pregnancy, it's in and of itself, it's its own unique situation. Because if I scan a pregnant breast, it's going to look different when you're not pregnant,
Okay.
right? It's a different stage. Now, we don't routinely do mammograms in under 40, the 20s, 30s, because this is hormonally active breast tissue. Okay. So we want to do no harm, or, studies haven't been done to show that it's beneficial to do it routinely. However, I think it's so important to do self-breast examinations,
Okay.
right? Because you should know what your breasts feel like. And people are like, oh, I don't know. I feel it and it's nodular everywhere. I don't know what I'm feeling. But you're going to know what feels normal for you.
Yeah.
That way, when something is different, and as women, we have this intuition, that feels different. Then you go check it out, and then they'll do an ultrasound for your breast,
Okay.
depending on your age. Start with that. And if we need to, then we go further and do a mammogram, right?
And this is advice. Please check in with your primary physician.
That is so key. This is
Okay.
I'm not going to be medical advice here. Yeah, this is super important to have that discussion with your primary care physician, right? Because that's that one-on-one relationship, and they know your history, they know what's best for you, right? They're going to know and going to help you, guide you through doing that, risk assessments and all, and tailor what you need to get based on what's going on in your life.
Yeah. Essentially what I'm hearing is it's really important. What I'm taking from it is also listening to your body.
Yeah.
Listening to your body. Because our bodies do speak to us.
Yes.
Right?
Always.
Yeah.
Yeah.
Always. And sorry.
Oh no, go ahead.
No.
Yeah.
I think it's so important, especially as Black women, you hear this where our concerns tend to be minimized. And if you go to a physician with a lump, a doctor cannot feel and say, oh, that's a cyst, or that's not cancer, because you don't know. We're taught things in school. If it's mobile, it's okay. I've seen cancers mobile, So you need to get imaging to find out what is there. if I say one thing, don't go to your doctor with a concern of what you know to be abnormal for you, and walk out being like, okay, yeah, they said it was okay.
Advocate for yourself,
Advocate for yourself.
especially as a Black woman.
Especially as Black women. Every woman, advocate for yourself. Ask questions. It's your body. You know, people come in and I do biopsies on them, and, you know, before they're like, is it okay if I ask a question? Yeah, ask the question. I'm about to work on you. You know, and of course, before I've explained everything, but it always surprises me. People are like scared to ask a question, or maybe they think, I don't know if they think you're not just going to get offended or whatever. This is your body.
Yeah.
You need to know what it's doing.
I think that speaks to, as someone who has gone through the medical world, not for for myself, but more so for my child, and I had to learn to speak up. What you're speaking to, I mean, you don't have this issue, but I think people just don't realize that the connection that the doctor, yes, they are a doctor, but they're also human, right? And I think that speaks to a whole other conversation that we can have. But I think there's that disconnect, which is why it's, you know, well, my left pinky hurts. The doctor looked at it. It could be a slight hairline fracture, but let's just say the doctor looked at it. It's like, oh, maybe it's just in pain. Give it a couple weeks. And they think, okay, that's what the doctor said. And it's not, I don't want to use the word going against the doctor, but just scared to advocate for themselves. Like, it's been like this for a month. Maybe I should, you know what I mean?
Yeah.
So I think that speaks to that. And the question that I wasn't asking, you totally answered it with what we can do to actually make that change and what to look for. So I want to know, if you were not a radiologist, what would you do? And what would be...
if I wasn't a radiologist in the medical field, I probably would have somehow found my way to the medical field anyway, but I think I probably would have done something in the sports industry.
Okay.
You know, if you know me, you know that I love fitness, and that's super important to me. And I think I wish it could be super important to everybody, because I think being fit and it's just so good for your mind, like just mentally. I would have been totally something sports related, or I would have done something in the beauty industry, because I love makeup. Like it's therapy, you know.
Okay.
I sit in the morning and get ready, and it's just
one of the same.
It's
Your she's still firing up.
it's just, I have like so many pink lipsticks. Like it's just Sephora
It's
knows
never
me.
enough.
Sephora knows me. Like I go to Chinook, and the one guy's like, I see you here all the time. I'm like, ooh, maybe I've been here too long.
Yeah,
too
because
much.
it's never enough.
It's never enough. But you know,
Literally said yesterday, she was like, I need to go to Sephora.
yeah. I mean, and it's not, people might think, oh, it's vanity, which really, it's okay what you think. That's not really my problem. But it's just, it's for me, you know, and it just,
You're just a girl.
I'm just a girl. I'm just a girl. Yeah, you know what, some people like, they go and they get a great bottle of wine, a different, like, I go there, every wine to me is the same. Like, I don't know.
Okay.
Like, I am not finessed in that department.
But every lip gloss is not the same too.
Every lip gloss is not the same.
Right?
It's your forte. It's your forte.
Yeah.
And you had touched on it earlier, and I forgot to circle back on it. You said you got your surprise when you were talking about your residency, and so basically you were pregnant during your residency. And I'm just curious, because I mean, the podcast is Mothers in the Middle. How did you navigate wrapping up your residency? How, like, did you have family support? Like, I just think that's just so important to highlight, because here you are, you've accomplished so many things, and will continue to accomplish many things. But
And you're doing so many things.
yeah, what was on the back end?
So I have a secret power. It's called my husband.
Okay.
Brent. He's my everything, you know. So my oldest daughter, I guess I missed that. I feel so embarrassed to say this, but missed that whole class. We had a surprise in my final year.
Happens.
I'm the only one, you know, we call her Blessing. She's just, you know, and I was like, oh my goodness, now what? What to do? You know, no money. I didn't have family here. I had my sister that lived, you know, close by, but that was it. And had her, and it was in the final year. So our final year, remember I told you we do all this training, and then the 5th year is the final year. And just, you finish that final year, you have to go through a board certification, right? And without that board certification, even though you've done the final years, you still got practice. Wow. And it's intense. So you've got to study and make sure you pass that exam, right? And to do it with a baby, oof, it was hard. You know, I tried to stay home and study, and there's this cute little baby, you want to play. And so, you know, Brent's like, you know, you need to stay in hospital and study. So I could not have done it without him, and my sister was there to help as well. And yeah, it was difficult, but failing was not an option.
Did he, so a newborn baby, you're in residency, you're staying in the hospital. Did he work? Like, were gender roles? Like, I feel like as an African woman, I'm just so curious.
Okay, so this is the thing. In Canada, we're blessed with maternity leave, or parental leave, I should say, right? And I did not take it, and because I had to finish. Because we didn't have any money. We no resources or anything like that. And so I didn't want to delay my residency, and he was working at the time. So I said, you know what? I'm going to use my vacation. And I took a little bit of it, I think maybe a month, but I said, you take the rest, right? And he was like, well, I'm not taking a rest. Like, I'm not going to stay home. Like, man doesn't stay home. I said, okay, well, if you don't stay home, then I guess we'll have to find somebody to look after the baby, because I can't stay home when he's not wanting to stay home. So parental leave is gone.
Yeah.
Well, so he quit his job and he stayed home.
Wow.
Yeah. And that's honestly has been the best thing. I know, but you know
I hate that we said wow, but it's just, I guess you don't hear it all the time.
You don't hear it all the time. And I think it's difficult for us I'm a mom, right? And I think, I'm going to say this unapologetically, he was in a lot of ways more maternal than I was.
Okay.
Right? He wanted 4 kids. So we have 2. I think, yeah, very good. You know, and
Rush you in the middle.
yeah, and it's okay. I know that he raised them and he taught them things that I never would have been able to. Part of that is culture, and I'll explain. You know, people said to me, you know, you asked me that if I hadn't done medicine or whatever. Okay, yeah, but I had to think about that because I didn't get a choice. My generation, we were told, this is what you're going to do. And you don't ask questions, right? So I did what my dad told me to do. And it's different now. Your kids, it's not a challenge. Well, it's a natural. Kids are going to challenge you, and you're going to have that conversation with them. And conversation is an art. And how do you have that conversation with them when you yourself weren't raised like that? You develop the art of conversation. You know, I see him talk to the girls, and I'm like, cool. You know, because to be honest, when they were growing up, I thought, well, they're going to do it because I said so.
Okay.
But it doesn't work that way, right? You have to talk to them and convince them, you know, you're going to do this because that and that. And I watch him and I'm like, wow, I couldn't do that.
In this generation, it doesn't work that way. But just like, I've talked about it, we've talked about it, like, that I wanted to be in the arts, right? But growing up African, absolutely not. I want to take a gap year, absolutely not.
No.
This is what you're doing. These are the parameters.
Yeah.
These are your options.
Your choices are within this box.
Yes, and that's
outlined
it,
for you.
right?
So pick one.
Yeah.
We're going to have a part 2. We're going to have a part 2.
It wasn't like that with the girls. Like they are strong, confident women raised by a man. And
a good man.
A good man, you know, and I think if any man has the privilege, and that's what it is, really, it's a privilege.
Yeah.
To be able to stay home and raise their children. Such a blessing.
Oh, thank you so much for sharing that. I just,
you know,
I love that. And I want to ask you, as we're like, okay, so you kind of touched on like you motherhood, the career, the beginning of your career, what you went through, the surprise baby, which was a blessing. So what would Dr. Ify of today say to Dr. Ify then, who was either in her 20s, mid-20s, you're pregnant, you just had your baby, you need to study for your board certification. What would you say to her by answering this or finishing the sentence of, you don't have to?
You don't have to rush. Take your time. Breathe. Like breath.
Mm-hmm.
It's a reflex and we take it for granted. We're such in a rush. Everything is go, 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 go.
I feel attacked.
we all do it. We all do it. In my hardest of times, I had this, if you have an Apple Watch or a watch, there's this app called Breathe. Have you seen it?
Well, I know that it can track your heartbeat, but I haven't heard of
it's actually it's Breathe, and in the hardest of times it would just have you breathe, and with the haptics, like 30 seconds, it just kind of goes through, and I use that, and it just take a breath, stop and take a breath, and smell the roses. We're so in a hurry to go where exactly, and COVID taught us that, go, and then all of a sudden, boom, you have to stop. And then it was a shock for a lot of people.
Absolutely.
Right? And I think take your time, recognizing that not everybody has that opportunity to, of course, there are people that need to, move it along because they need, take a loan. They'll have time to pay it off, but just take time and breathe and do what you love, what you're passionate about. Because if you are not passionate about what you're doing in life, then that's not life.
It's going to catch up to you.
Yeah.
I like that. And that's been I think it's been a common theme, actually. Very similar answers. And we've been talking to, what I would say for the most part, are very mature women who've had some experience in their career, in motherhood as well. So I love your answer. I'm so grateful that you spent time with us today. Thank you for being on this episode.
Oh my goodness, yeah, we'll have to have a part 2.
No, we definitely do. Off the line and also in front of the camera. But no, thank you. This has been great.
Thank you for having me.
I felt very edified. It's nice to talk to a woman who's brilliant, who's smart, accomplished, and also has a good balance. Like you teach that in class.
Yes,
you're also a doctor.
Thank you so much. It's a pleasure being here, really.
Yeah, thank you.
I love what you guys are doing. You're raising, this platform, talking to moms, and yeah.
I think, we honestly, this idea, because it all started because she's a new mom. I already have 3 kids, and it's I think the beauty of it, it's even through you, I feel like I have learned so much from you, and in exchange, you have made me feel like you've also learned from me. So it's
oh yeah.
Why
every
not?
Stage is beautiful. Every stage has its own challenges, but it all culminates to something beautiful in here.
Yeah, it's hard. I think it's hard. I'll speak for new moms who relate to me, because not every mom feels that way, but I think it's hard to feel that at the beginning because you're just in the trenches, especially when it's your first time.
Oh yeah.
Ooh. But you know what? The seasoned moms always tell me that it's gonna get better. It gets better. And you're gonna miss these years.
I literally was gonna say there will be a time you're gonna look back and be like, oh my God, I wish she was like this. Yeah. And in this moment now, you're like, oh, you wanted to go.
Yeah.
Just come down.
Yeah.
Quiet.
Yeah.
Trust me.
See ya. Oh, thank you so much, and thank you to our viewers for tuning in. This was Mothers in the Middle.
We love you too, listeners. Bye.
Bye.